Good evening, everyone. Thanks for joining us tonight. I am Scott Allen. I am the CEO for the Family Medicine Education Consortium, and welcome to our Family Medicine Residency Virtual Showcase. Tonight, the topic is lifestyle medicine, and you're going to hear about the UPMC Altoona Family Physician Residency Program. And just after I give you a little bit of background about the FMEC. So I think most of you know who we are, but just in case you don't, we are a catalyst convener and incubator is our tagline, and we really work on three different focuses. One is to encourage medical students to choose family medicine or primary care for their specialty. So we work a lot with medical students. We like to support family medicine residents while they're in training, giving them opportunities to do scholarly work, to present at our meeting, to meet each other and learn from each other. Then we also like to support family medicine faculty at the 200 or so residency programs in our region by helping them learn how to teach better, meet guidelines, meet each other, do collaborative projects. We have our main activity is an annual meeting in the fall. We have a meeting coming up in October 13th through the 15th in Providence, Rhode Island. So hopefully some of you are attending that meeting. We have about 300 medical students coming on scholarships. And if you're not planning to attend that meeting, hopefully you can put in your calendar to attend our 2024 meeting, which is September 19th through the 21st in Philadelphia. So with that, I am going to stop sharing my screen, and I'm going to turn it over to Dr. Marr.
Hi there, everybody. Good evening. I'm Dr. Maurer, Megan Maurer. And I'm one of the faculty at UPMC Altoona Family Physicians, and I'm in charge of our lifestyle medicine residency curriculum here. I'm board certified in lifestyle medicine and also in obesity medicine, and I actually do a didactic curriculum in obesity medicine as well. And we're just going to talk a little bit about our curriculum tonight and a little bit about lifestyle medicine, and I'm actually going to keep it pretty casual and mostly answer questions and whatever you guys want to talk about lifestyle medicine tonight. I'm going to start off just with some introductions. So I told you a little bit about me as far as, fun facts. I'm also a mom of 4, so I'm a pretty busy person too. So I guess we'll start with introducing everybody else. The only faculty I see here besides me is Dr. Sweeney, so we'll start with her.
Fine. Well, hi. I'm having a lifestyle right now. I'm going to the integrative medicine conference at Duquesne tomorrow, which will have a lot of lifestyle things in it. They're going to have things for lifestyles in the elderly, social disparities in lifestyle. And because I'm an early to bed girl, forgive me, I had to have my healthy dinner. And I did have a salad if anybody wants me to vouch for it. I don't know if I'm not going to try to play with the camera because it took me about 10 minutes to figure out how to do this. So I apologize ahead for nibbling on my salad while we're doing this. I usually don't eat on Zoom, but I didn't want to miss this. So, and I guess I should tell you what I do besides that I eat out. I am in charge of the osteopathic curriculum, and I'm one of the family medicine faculty. And my son just got married last week, so I have a little wedding brain. So you'll have to forgive me. We had people from all around the world, Thailand, Germany, France. So it was really busy. So that's me. And then I'll let you introduce other people, Dr. Maurer.
And Dr. Sweeney is also actually doing our lifestyle medicine curriculum too. So she will, when she's finished, be board certified in lifestyle medicine too. So let's move on to our residents. And I'm just going who's next to me on the screen. So Malika is next. Dr. Joseph.
Hi, I'm Malika Joseph. I'm one of the second years here at the program. I am from Trinidad and Tobago, so Altoona was an adjustment. I am part of the lifestyle medicine curriculum, obviously, and I find that it's very helpful with educating and counseling my patients.
Okay, I think I have Alexandra next on my screen.
Hi, everybody. I'm Alexandra. I'm one of the third-year family medicine residents at our program and also doing the lifestyle medicine curriculum. Dr. Alberts, he's not on this call, but one of my co-residents and I just started our kind of lifestyle medicine focused quality improvement project, which is really exciting. which is shared medical appointments or group visits focused on counseling patients on different aspects of lifestyle medicine. So that's really cool. And my fun fact is I got married on the weekend. So very exciting. Mentally, I'm still there. I'm not back at work.
And then we have Maria Rosa.
Hi, I'm Maria Rosa. I'm an intern at UPMC Altoona. And I joined the lifestyle medicine curriculum recently. I haven't really had the opportunity to do much yet, but I joined it because when I was in med school, I did culinary medicine elective, and I thought it was a really not only like fun to learn about nutrition and cooking and stuff, but I also thought it's like really helpful to a lot of patients because a lot of people are just like not aware about lifestyle, like healthy habits and how to like cooking and exercise and all that.
And I'm so glad you brought up culinary medicine, actually, because I'm currently in the process of taking a culinary medicine coaching course. I actually literally just had a class right before this about how to teach culinary medicine, and I'm hoping to actually work on a curriculum for that at some point, and get a bit of a teaching kitchen going at AFP. And
That'd be fun.
yeah, and we actually had a grant earlier this year where we were doing some cooking demos out in the community and teaching out in, how to cook certain recipes and things to people out in the community. So that was pretty fun. So I'm hoping to do some more culinary medicine at AFP. So I'm glad you brought that up. Thank you. And then last but not least for our residents, we have Megan Thompson.
Hi, like Maria Rosa, I am also an intern. I'm on OB right now in the hospital, so I will also be eating. I am not eating a salad like Dr. Sweeney, which is one of the things that I really like about lifestyle medicine, is that it's not a set of rules. It's a lifestyle. It's about a set of habits that sometimes you deviate from. I am having pasta from the cafeteria. I did have a salad with chicken tenders on it for lunch this morning. So it's all about balance, but I also don't have a lot of experience yet with our curriculum since I've just started, but I was really interested in it because I was kind of disillusioned, if you can be disillusioned as an intern, with like our modern system of medicine, like where we're adding more medicines and more medicines. And I think when we look at an overall scheme, we see that's not an effective form. People are just getting sicker and having more medications. No offense to the pharmacist in the room, but I was looking for other avenues to address that in my patient population.
And speaking of the pharmacist in the room, I did invite Mike Geishauser, our clinical pharmacist. He's a PharmD, and he's actually working on the lifestyle medicine certification for healthcare professionals. So I invited him to join us tonight too. And I think he has a interest in de-prescribing. So I invited him on. He can tell us a little more about himself too.
Yeah, I was just gonna say that de-prescribing is a big deal. I, like Megan said, I'm the clinical pharmacist at AFP. Help her out with the weight management clinic. I just recently took over our diabetes clinic from an endocrinologist, so a lot of lifestyle in that too. So it's one of my interests.
Yeah, and so he mentioned our weight management clinic. We do also have an interdisciplinary weight management clinic at AFP that involves Mike, our clinical pharmacist, but also we have a dietitian named Jody. She's wonderful. And we have a nurse manager, Barb, who helps coordinate care with our patients. And then we had a social worker and he left, but hopefully we'll have another one to take his place soon. But I already miss Frank. But we do a whole separate clinic where we do a lot of lifestyle medicine, although in our clinic we also do use medications in that particular clinic. So but that involves a lot of lifestyle medicine as well. So just for those of you who aren't familiar with lifestyle medicine, it's basically using lifestyle interventions to prevent, treat, or even in some cases reverse disease. And the 6 pillars of lifestyle medicine are nutrition, especially a whole food plant predominant diet, physical activity, sleep, which happens to be my favorite pillar because I have 4 children and don't ever get enough, stress management, and avoidance of risky substances and social connectedness. And of course, since it's estimated that 80% of chronic disease is caused by lifestyle factors, we can really make a big difference in our patients' lives with lifestyle medicine. So I think it's really important. And we started our lifestyle medicine curriculum here at AFP in 2021. And it's a track that our residents can choose to participate in, but all the residents get some didactics in lifestyle medicine. So it's not like you don't get any of it if you don't do the track. But residents that do choose to participate in the track do a requisite number of patient encounters where they do the counseling. So they get lots of practice with counseling their patients. And they also have a prescribed number of group activities, which can be anything like the cooking demos we did in the community, or Alexandra has led some fitness, some hip hop classes, which have been really fun. But I usually leave that pretty open and let the residents kind of be creative with what they do for the group activities. I usually don't force them to do any one thing. And then there's also required hours for intensive therapeutic lifestyle change programs, and that is usually fulfilled in our weight management clinic. So they get to, do a lot of practicing with counseling there as well. And then when our residents who do the track and complete that curriculum are finished with their 3 years, they're actually qualified to sit for the lifestyle medicine boards. And upon passing that exam, they are considered board certified lifestyle medicine physicians. So that's a little bit about the curriculum and about lifestyle medicine in general. And with that, I'm actually just going to open it up for questions and, sort of leave it open to you guys. If you don't have any specific questions, I have a few canned questions that we can do, but I kind of want to let this be, student directed. So I'll let you guys start.
Hi, good evening. I'm Fiona, fourth year medical student at Rowan School of Osteopathic Medicine in New Jersey. I'm currently on an integrative medicine rotation through the Andrew Weil Center in Arizona. And I also have a special interest in functional medicine. Hopefully that's one of my professional goals, is to become certified. So I was wondering what your program, how kind of your program's design can help me achieve my goals. Thank you.
Sure. So Rowan is actually my alma mater, so that's awesome. It wasn't called Rowan when I went there, though, because I'm really old. It was UMDNJ then. But so one thing I will mention is, so there, in addition to the lifestyle medicine track, you get plenty of elective time at our program as a resident. But there's also what we have is individualized curriculum, and I'm going to probably get I'm going to have Kathy, I'm going to get it wrong. It's the ICC, and you can actually do an individualized curriculum for yourself, where you can actually use some of your elective time to sort of tailor to your interests. And, you have your CPI project tailored around that, and, have your elective time tailored around that. And actually, I think, Alexandra, are you doing your ICC in lifestyle medicine?
Yeah, the group visits.
So maybe you want to talk a little bit more about that too.
Yeah, I mean, so Anudeep and I were both doing the lifestyle medicine curriculum, and when it came time to thinking about our quality improvement project or CPI project, we wanted to do something related to lifestyle medicine to kind of help integrate it with our own curriculum. And Dr. Maurer was actually the one who suggested that we look into shared medical appointments. And essentially what we're doing is we got baseline like labs for everybody. So an updated A1C and a lipid panel. And at the very first visit, we're getting a baseline waist circumference and weight. And we're, keeping note of that. And then at the end of 6 group visits, where we're doing specific counseling on different pillars of lifestyle medicine, but mainly focusing on the nutrition pillar, we provided them with like a cookbook and other resources and that kind of thing. So we also have a dietitian involved in the group visits. And at the end of all of the visits, we're going to recheck the A1C, the lipid panel, the weight, the waist circumference. And we're hoping we're going to see a trend in the, downward direction for all of those numbers. So yeah, that's how we're, doing our project related to lifestyle medicine. I think it's going to be really good. Our first visit went well. We just did that earlier this month. So, yeah.
But we've had residents do ICCs and all kinds of things.
Mhm.
We've had one resident who did one that included OMT and acupuncture. We've had residents do them in derm. We've had ones doing aesthetics. So, I mean, you really could tailor it. You know, if you wanted to do one that included integrative medicine, you absolutely could. So, and I think actually our resident that did the one in acupuncture, Kathy, didn't she take an acupuncture course as part of her ICC?
Yes, she did, Dr. Maurer, and Dr. Beckstead supported that. So she went away to Boston and check. And I'll soon be walking and doing my lifestyle thing back to the hotel. But yeah, he supported her in that, and she did the acupuncture course, and he financially supported her and with time. So, you know, there's lots of things you can do. And I must say to that student, I'm very jealous. I've seen things that they do at that Whale Institute, and that's super cool.
So did
And
that
everything
answer your
fits.
question okay?
Yes,
Yeah,
you
and
guys answered it wonderfully. Thank you. Yeah, I'm having a great time with the rotation and, oh, sorry. We're kind of like talking over each other a little.
You go ahead.
I just wanted to say that it's been a really great experience so far, and the Andrew Weil Center has just been incredible with like the depth and the breadth of knowledge that I've just learned in a month. I feel like, you know, it's been really encouraging to be with a lot of like-minded individuals as well, and to kind of help turn the tide with kind of the over medication of our population here in the US especially.
Yeah, I'm so sorry. I didn't mean to talk over you, but what I was going to say is it fits in really well with our osteopathic curriculum, which is very strong, and it really is osteopathic principles, which is why Dr. Maurer and I are extra excited about lifestyle medicine.
Anybody else? Any other questions?
Hi, everybody. This is Jyotan Sanani.
Hi.
Thank you for having us today. I wanted to ask, like, do you have any participation in the schools also, so that from the kindergarten going upwards, so that the students, the children of tomorrow, they also get into a good lifestyle from the very beginning, rather than like going on in a reverse direction, going on learning all wrong things, and then later on realizing what was wrong. Thank you.
Yeah, so I think that's a great idea. And I feel like I remember last year when we did our chat, we ended up having like this really great brainstorming session for like group activities and stuff for the curriculum. And the one thing I will say is that for the group activity hours, like I mentioned before, I'm really very flexible for what the residents do for their group hours. So at this point, we now, because of the grant we did, we now have these mobile cooking carts that could really go anywhere. They're complete with, you know, induction burners and induction cookware and knives and cutting boards and everything you really need, aside from an oven, I guess. But so truly our lifestyle medicine residents, if they wanted to, for either their group hours or for you know, for a CPI project or, you know, just for community outreach, if they wanted to do it, could go into a school or wherever they wanted to, and do those cooking demos. So certainly that is something we could do. Our grant just ended at the end of June. So our equipment is still a little bit new to us. But like I said, I'm really flexible and open to pretty much whatever they want to do for their ideas. I've not said no to a whole lot of things, so as they can attest to. And actually, I'm doing another cooking demo in the library here in November, so down the road here. So, and actually, I'm cooking at Grand Rounds tomorrow morning too. So.
Yeah, I wanted to ask another question was that, do you have a fixed cutoff on year of graduation, or like that's a flexible one depending upon individual experiences?
You mean it's in like for applying, or?
Yeah, for applying.
I think probably Dr. Sweeney might know that better than I do.
We do a holistic evaluation, and we don't have strict guidelines. And we will take a look at everybody in a very holistic manner.
Thank you so much.
Sure. What other questions do people have?
Hi, my name is Alia Rana. I'm a medical student at St. Matthew's University.
Hi.
And I wanted to know, do you guys offer like rotations to medical students on lifestyle medicine?
So we don't have a particular lifestyle medicine rotation per se, but if you wanted to do a rotation with us, I mean, we tailor our rotations typically to what students like. And certainly we have our diabetes clinic, we have our weight management clinic, you know, and you could certainly rotate with lots of the lifestyle medicine residents. They do a lot of lifestyle medicine in their regular day-to-day visits. I don't know if Dr. Sweeney has anything to add to that, but that's what I would say.
No, I think you covered it nicely, Megan. I was going to mention with the other question about the kids, you know, Dr. Humphrey, our endocrinologist, ran for the school board in Hollidaysburg because he wanted to change some of the things in the cafeteria and the sugary drinks. I don't know how successful he was, but that's why he was on the school board.
It's tough to sell. It's hard.
Yeah, I just want to say I went to St. Matthew's, so hello. Same school.
Hi.
Okay, who's next? Anybody else have another question?
Yes, can I ask you a question?
Sure.
It is a pleasure to meet with you, doctors, and all the team, wonderful team. My name is Lina Cheresian. I graduated from an osteopathic medicine in May 2020 from NYIT in New York. And I have been doing some kind of rotations in New Jersey and North Carolina, all of those departments. I'm still doing those rotations to just keep up with the medicine. And I am a vegetarian. I am originally from Syria. I like to cook Mediterranean food. I can give you a list of those food which I can cook. And I really like the idea about you said about the lifestyle. For example, you mentioned physical activity and the sleep and the cognitive behavioral, for example. I met during my rotation with people who they are a little bit maybe elderly, but they are really, for example, they live alone. And I felt that it's really, even if I am going to talk to them about to have a good lifestyle, but their mentality, they are alone. And I felt that it's really good that to have a counseling part, not just physical and the food and the counseling, it's something very good. My question is, for example, is there any date, for example, you can maybe, for example, all of the residents, they will have this one day to cook and give, for example, in the hospital by itself, the food, and they can try and to see how it's the vegetarian, for example, the healthy food, how it works with the doctors and with everyone in the hospital. And my second question is, for example, I had to fail in Comlex 2, but I passed step 1, Comlex 1, Comlex 2, Comlex 3, and PE. Is going to be for me any reason not to apply, or it's okay?
So the question about the testing, I think it probably is the same answer that Dr. Sweeney gave earlier as far as the holistic review. I don't know, or maybe she has a different answer, but I'm sorry, I'm not really the person that does the, you know, the reviewing the applications or anything. So I'm not really necessarily the best person to answer that question. But as far as the question about, you know, trying vegetarian or plant-based meals, I will tell you that trying to get the food changed in our hospital cafeteria has been an uphill battle that me and Dr. Gala, one of our former residents, now a fellow at our palliative program, have tried a couple of times. but across our UPMC system, all of the lifestyle medicine faculty, we've been now trying to do it as a group, joined forces. And we are trying to get more plant-based options available in the cafeteria and also available to the patients who are hospitalized. And certainly cooking for the staff and residents and everyone in the hospital is an idea I've toyed around with. The issue is, of course, the facilities and letting us use them. So I have not yet done that. But certainly I think that you bring up a good point that, you know, we don't necessarily serve the best stuff in the hospitals for patients or for the people who come to the hospital to visit or work. So, I mean, I know when I'm on inpatient, I usually pack my lunch. So, but we have been trying, and supposedly there were supposed to be plant-based options available for our patients. I tried last time I was on inpatient and didn't get anywhere, but we are working as a UPMC lifestyle medicine group collective to try to make that change. So before we do any more questions, I see I have another one of my residents and another one of my faculty on, so I'm going to let them introduce themselves. So Dr. Katoy, she's one of our faculty, and then Dr. Trabacco, if he wants to introduce himself, he's one of our residents. So.
Hi, everybody. I'm Amanda Katoy. I apologize for my tardiness. My husband and I are in the process of moving, so this was the best I could do. But it's nice to see you all. We're very excited about lifestyle medicine at UPMC Altoona, and I'm hoping we can answer your questions and get to know you a little bit.
Kyle, did you want to say hi too?
Hey, I'm Kyle. I'm one of the second years now. I think big thing that I can talk about where I did sort of help Dr. Maurer with the cooking demos earlier. So I've had some experience with setting those up, the equipment and everything like that.
Yeah, and don't let him be shy. He's actually the one that like wrote for and got us that grant. Like he's like the big guy behind all that. He basically is responsible for us having all that cooking equipment. So he'll pretend like he's like a helper, but he's like the big driving force behind all that. So so he's been, you know, awesome in helping us, instrumental even in helping us with that. So thank you, Kyle. All right, so we'll go back to questions. What questions does anybody else have? And if not, I will pose some questions to my residents. All right, well then, I'm going to pose this question to Miss Alexandra. Mrs. now, because she got married last weekend. So I just was curious, do you think that this curriculum has enhanced the care of your patients, especially since you're towards the end of your training now? So I feel like you could probably answer that one.
Yeah, absolutely. I was actually just thinking about that today, because I had a patient come in for like diabetes follow-up, type 2 diabetes, and his A1C just like a little over 2 months ago was 11.5, like out of control, you know, not eating well, all those things. He was already on insulin. So I really didn't do that much to like adjust his medicines, truly. Like I think maybe I added Trulicity or something, but I really kind of had like a, who says this all the time in our program? I had like a come to Jesus talk with him. I forget who says that. One of our faculty does. But anyways, maybe it was you, Dr. Maurer. Anyways, so yes, I had like a big talk with him back in July.
I say that a lot.
Yeah, maybe it's Mike. So anyways, yeah, so like, you know, we really talked about how, you know, like he can't keep doing what he's doing, and he had like this horrible foot ulcer and all these things. And so I think, you know, and I counseled him a lot, and we've had multiple visits, and then I rechecked his A1C in the office today, and it was 7.7.
Yay.
And it was like just amazing. Like he was in shock. You know, like his mom was there too, and because he's a little like intellectual disability, but like we're all like so proud of him, and I'm like tearing up. Oh my God, I'm such a baby. But yeah, like it was just so wonderful to see, you know, that like physical activity and nutrition and all those things I talked to him about really made such a big impact, on him. And like, I think that's amazing. I've used the lifestyle medicine a lot for like smoking cessation counseling too. And I've got patients to like help quit smoking or like significantly cut back. So yeah, like I've seen it make a really big difference in patient care and like their quality of life. And yeah, I'm just really glad that I've done it, and I'm excited to see where these group visits go to. Yeah.
Yeah, that's been pretty cool so far. I will be excited to see where they go to. So, all right, let's see. Before I do another question, did that spark any questions for any of the participants here? Because I actually had a patient with a similar story. He came to me with an A1C of like 13, newly diagnosed, and with a little metformin and lifestyle change, he got down to 6.5. So you'd be amazed how quickly you can, and how dramatically you can have people change their health. So it's always impressive, and it makes your job a lot more fun, right? Because you actually get results. You don't feel like you're just treading water, which is sometimes how it can feel. So I guess this is for maybe Dr. Katoy. How about this? Since I know she's about to have a baby here in a couple months, so maybe this is a good one for you. Do you think that our lifestyle medicine curriculum and training has improved your own self-care?
I do, absolutely. So I think that as you go through medical training, I apologize, it's really echoey in here. As you go through your training, you learn nutrition stuff. You know you're supposed to get a certain amount of exercise, but it's really hard to put that into practice when you're busy, especially as a resident. But getting some of the lifestyle medicine education, it was a lot more granular, and it really gives you some advice on how to teach patients how to incorporate it into their lives, which was also good for me. And I will say too, I didn't feel like I knew a ton about nutrition. So we had maybe 1 or 2 lectures in medical school about it, other than eat your leafy greens and stay away from sugary beverages. I had never had a lot of, good, solid, granular advice to give to my patients. So going through this training, learning about things, I do think it has helped me make healthier choices and let me take the advice that I'm trying to give to my patients to make more positive changes, to carve out a little more time in the evenings to do a walk, or to, just get outside and get active with my family. So I do think it's really helped my own personal wellness in a lot of different ways.
That's great, which is good, because we do know that, doctors that practice what they preach, so to speak, are more likely to counsel their patients. So it is really important. I'm glad that you brought up about the like teaching how to counsel patients, because that is also part of the curriculum. We do have a whole unit on teaching about health behavior change and motivational interviewing and things like that. So I do think that that's really important. It's not just the education about like, what are you supposed to do? It's also about, how to talk to your patients about it, which is really important, because that's a difficult conversation to have. So any other questions from the students? Yeah.
Yes, I have other question about, for example, you mentioned about the diet and the physical activity. Is there, for example, the clinic which you are mentioning about, for example, the intern and the resident 2nd and 3rd year, they go, looks like they are at the outpatient, or how it works, this clinic, for example? Is it, for example, you just teach the patient as a group, or how you
mean
manage
like
this case?
Do you mean our family medicine clinic?
Yes.
Or do you mean our,
yes, the family medicine.
So our residents have their own panel of patients from day one that they take care of. So I mean, they literally get to be people's family doctors from day one. So that they're, somebody can say, oh, that's my doctor. So, even from the get-go. So, they're seeing the same people and taking care of them from day one for their whole 3 years here. So.
Okay. And is there any researches for obesity or for example, diabetes? That way, the resident they will involve in these researches or not?
I'm sorry. Let me say. Can you say your question again?
Any do is the program offer any research for obesity or diabetes or any endocrinology, any kind of this to help the patients?
So we don't do a whole lot of research. However, I will tell you that for our weight management clinic, we have been collecting data on our patients that I'm hoping at some point to publish because we've had such great results with our patients. And I think the model that we have is pretty good. And so at some point I was thinking about publishing that and maybe primer or something like that. I haven't done it yet though, so I can't say yes, we have research because it's still an idea in my head. But I know, I mean, I will say that our residents do, posters and present at our scholarship day and things like that. But as far as like, published in journals or, I mean, not a whole lot of that, no, a lot of bench research or anything like that, but.
Yeah, I was going to say we do a lot of QI projects, and
yes,
we've had an ongoing QI project for the past 3 years about diabetes care gaps, and a lot of that has been lifestyle.
Yeah, that's a better way to put it. Thank you, Mike.
Thank you.
Quality and safety initiatives is probably a better way to put it. Yeah.
I had a question.
Yes.
I don't know if this is related to the lifestyle medicine curriculum or just a residency program general question.
Sure.
But I wanted to know what differentiates your program from the other UPMC family medicine programs.
So I'm actually going to let the residents answer this first because I don't want to monopolize this question. I mean, I could give my own answers because I was also a resident here, but I'm going to let the residents take this first.
So I've been really quiet, so I think I can take this one. I think a big part of it is the culture of the program and being so well supported. And I think that this has kind of been hinted to before, but our program director, Dr. Beck, said he really goes out of his way to make sure that whatever your goals are coming to residency, that you find a way to achieve them. I know that we spoke before about the ICC and stuff like that, but there is a resident who is doing like procedures and aesthetics for her ICC, and on her non-mandatory rotation, she has a half day where she just does procedures in office. And whatever you want to do, you can, the program will work with you to achieve it at the end of your residency, and I think that's really great. Also, I can say that I started late because I had some issues with my visa, and I also didn't drive for most of my first year. And I have gotten rides from faculty, staff, and residents, and everyone here has been super welcoming and going out of their way to make sure that I caught up on everything that I did miss. So, like I said, it speaks a lot about the culture of the program, and I just think that we have a lot of fun here.
And I just wanted to add that as a medical student, I rotated at other UPMC family medicine programs. And while like UPMC in general, I would say has great resources and great programs, the program here at Altoona definitely, like Malika says, has the nicest people, and they really do care about what your individual interests are and your learning. And the support here, I think is probably one of the strongest parts of the program.
Do any of the other residents have anything they want to add? So I know Alexandra's been here a while.
Yeah.
I can say,
Kyle.
never mind.
No, you go first, Kyle.
Oh, sure. I guess, yeah, I can't think of another place that would have let me do all of the nonsense that I've done here so far with the food pharmacy and the pop-up cooking demos and some of the stuff with LGBT healthcare. So kind of feel really supported in all the different avenues that I've wanted to go down.
Yeah, and I was just gonna say, I don't know what it's like at like other UPMC programs in terms of your outpatient training, but like I'm from Canada, and just comparing my outpatient training to the ones like in Ontario and other places, they aren't like the PCP for their patients. They see their patients under the attending. And I feel that it's more impactful now, like the way I'm being trained, where I'm the doctor for my patients and they see me that way. And, I see them continuously over time, over the past 3 years. And I just think that's really cool. I don't know if it's like that at other UPMC programs or not, but that's one of my favorite parts about our program, is having that like autonomy.
Our program is also the only residency program here in our hospital. So our residents get to be, first assist on the C-sections when they're on OB, they get to first assist on surgeries, and, they're running all the codes there. So, I mean, like we're it. So that's kind of cool. We get a lot of opportunities. And I think our rural location really affords, I don't know. Fiona, you know how it is in Jersey, right? It's a lot different. Like for me, family medicine there was a lot different in that, I don't know, there were a lot more referrals and a lot less managing of stuff yourself. I just feel like I really work to the top of my scope of practice. Like I'm managing things until I truly need a specialist, because we don't have, like, I really get to manage a lot more than I would if there were like, specialists up the street everywhere. So because of our rural location, we do a lot of procedures. I don't know. I just think we get to do a lot of different stuff, and it's a lot of fun. So, and obviously I think the culture is great because I came back. So I left and then I came back. I couldn't stay away.
Yeah, I think Dr. Maurer, and now I'm stationary, so I apologize for all that moving around, but don't like to be out too late in the city because I'm really not a city girl. But we do a lot of, like yesterday, what was it? Was it yesterday we did our dermatology day for all the first years, and we taught them shaves, scoops, excisions, cryotherapy. One of our TY graduates came back and did a really nice dermatology talk for us. Dr. Katoy and Dr. Kadia chaired that. It was just wonderful. But I think one of the biggest things is, although, as you said, we have on free run of the hospital, we're also very supported. You're never going to feel like you don't have a senior resident or an attending helping you. So there's lots of opportunities to kind of individualize what you want to do, your independence, kind of go with what you're comfortable with, and yet will help nurture you and help you advance, if that helps.
Thank you for all your answers to my question. Thank you.
I think another, I heard there were a few osteopathic physicians on the call. One of the unique things about our program is we really have a very strong osteopathic recognition curriculum. It's not you watch videos. It's not that we take something from a medical school. Dr. Maurer, myself, Dr. Fabina, Dr. Olstein, and Dr. DeBan all come together, and Dr. Fabina and I primarily have kind of come up with a curriculum so that by the time you leave here, you're super comfortable using your OMT skills in the office. And our MDs participate also. They learn things as well. So I think that's a unique part of our program.
Yeah, I agree. I'm glad you brought that up because we didn't mention that. What other questions do you guys have about lifestyle medicine or AFP or lifestyle medicine at AFP?
Can I ask another question?
Sure.
Yeah, I am glad to hear that you do have the clinic for OMM. It's something, then when you do OMM with the resident, the attending will be with them, yeah, during that manipulation, the treatment manipulation. And the other question is, do you offer the resident to go to rural areas to help in the clinic, outpatient or anything like that?
I'll take the OMT question and then I'll have Megan take the rural question, or one of the rural residents, but I don't know if we have a rural resident on right now. The OMT, we have a clinic, but the clinic is not the primary place you use your OMT skills. Our curriculum involves hands-on workshops every month for about 1.75 hours. We run those, and they're all very hands-on. The clinic's the time that I spend time, or Dr. Fabina or Maurer or I, one-on-one with you treating patients to help you learn. But as I could see Maria Rosa's head nodding, she does a lot of OMT. We want you to learn to integrate it into your family medicine practice. Maria Rosa, do you want to comment on that? Because I saw your head nodding.
Yeah, sure. I did OMT on I guess maybe it was like 2 patients now, and I've offered it to like most of my patients that have complaints of like musculoskeletal pain, so I'm sure I will be doing more of it. But you could precept with the preceptor about what you want to treat them with and what you want to do, and you can ask their questions, but you get to do the OMT on your patients. So you do have attending there that will help you, but it's like you're the one that's doing it. And you get to decide sort of like what treatments you think are appropriate for them.
And
it's like built into your office schedule. Sorry.
No, I was just going to say the MDs and DOs will precept you. It's not like you have to have a DO preceptor, but we happen to have 5 osteopathic faculty, so there's a lot of us.
Thank you. Can I tell you a story about little case? I had a patient. He came to the clinic and he has constipation. I asked the attending if I can do for him mesenteric lift. She told me yes, why not? And we told him to come a couple of times to do it for him. After 3 days, he came. He said, "Oof, I feel very good now." It works with him.
As far as your question about the rural,
works.
I was just going to answer your question about the rural office. So, Altoona isn't like, a huge city to begin with, but we do also have a rural office, and we have 2 residents typically per year that come out here and see their continuity patients out here at our rural office. And this is like my home base out here at our rural office. And so they see their continuity patients here. It's a different feel out here. The patient population's a little bit different. We're surrounded by farms, and we don't, it's a really tiny town. We don't have any traffic lights. I'd say there's about maybe 1,500 people in the town here. I live at the top of the hill, so it's actually the town I live in too. So the people who come out here do their continuity patients here, but all the residents also do a rural rotation where they come out here and rotate as well. And then, the residents do come out here and there to do days where they come out and do sick call or whatever as well. So we do have a satellite office that's a rural office as well. So you get that exposure. I'd say rural medicine is probably one of our other strong points of the program here. So
thank you. Thank you.
Any other questions?
Just a comment. As somebody who's lived in like large cities my whole life, I would consider Altoona like rural.
Yeah, I know, it's really funny because that's what I was going to say. That's why I said Altoona is not especially large either, because it's really funny when, a long time ago when I actually interviewed at Hershey to be a faculty, they consider State College to be their rural site, and State College is like bigger than Altoona. So it's really funny that we have a rural site off of Altoona, because Altoona, I'm trying to think about, Mike, about how many people do you think are in Altoona?
About 45,000.
There, I knew he would know the answer because he's from Altoona.
Yeah. The Altoona is, if you look at Pennsylvania, you're familiar with Pennsylvania, we have a lot of small cities like that with about 40,000 people, and then lots of surrounding rural communities and small towns. And they would consider us their commercial hub, their medical care hub, that sort of thing. And our hospital is a level 2 trauma center, and we have 5 ICUs. So we really do service a large swath of the state, from the top of New York State down to Maryland. So We do medical care is very centralized for us from that part of the state.
That being
was gonna
said, though, it's the cost of living is still quite low here, and you're still only a stone's throw away from lots of hiking trails, and it's a very beautiful place to live. So I mean, you have kind of the perks of being at a hospital where it's a, you know, stroke center and a trauma center to learn, and but still you can get a cheap house.
Yeah, you know, yesterday before my family flew back to Thailand, we took them for a day, and my son's girlfriend wanted to see where the Amish live. So we went back and we saw the Amish schoolhouse with the kids playing outside. There happened to be a funeral. We saw the buggies. Then we went to Trough Creek Park, which if you've not been there, it's just gorgeous with balanced boulders and waterfalls. And then we went to Lake Raystown. So in one day, we were able to really do a lot of fun things, you know, right in our area.
I was gonna say it's kind of funny around us because it's true. Everybody around Altoona thinks Altoona is like a major city. So I grew up in a town like probably 20 minutes from Altoona that had 1,300 people, and every time they would say, "Oh, I'm going into the city," and it's like just a town with 40,000 people, not 1,300.
Yeah, that's kind of the unique part about our residency is like Dr. Maurer was saying, we have the ability to do all sorts of things in the hospital because we are the only residency we have a transitional year program with 4 residents and the family medicine people, but we also have you know, and all the specialists that you need, but you're not dealing with cities and long commutes or anything like that, or traffic.
Or
Any
high
other
taxes.
any other questions we have about? One thing I want to let you know is Family Medicine Educational Consortium. Are any of the students going that are on the call?
I'll
Oh,
also be going.
yeah,
I'll be going as well. Yeah.
great. Well, you, Fiona and Alaya, I hope I'm saying that right. I hope you get to go to our sessions. Our osteopathic faculty are going to be doing with the residents in OMT for low back session. And Megan, you're doing a session. Do you want to tell them about that?
Yeah, actually, Mike is helping me too. We're doing a presentation about our interdisciplinary weight management clinic and basically how it's run and some of the stats for our patients. So be nice to see you guys there. Any last minute questions? I did want to end on time because it's always good to end on time. So any last minute questions from anybody?
I have to get going, but thank you, everybody.
See Alexandra, thank you. All right, well, I will put my email in the chat so you guys have it. If you guys think of anything else, just let me know. It's very nice to see everybody.
And feel free to reach out if you have questions about the program or meet us at Family Medicine Educational Consortium.
Yep, thank you all for participating.
Thank you.
Thank you, everyone.
Thank you very much.
Good night.
Good night.